Good morning, everyone, and welcome to April's Day of Prayer here at Maryknoll Fathers and Brothers. Each month, Pope Francis asks us to say a prayer for a special intention of his. The intention for April is for healthcare workers. And I'm happy to welcome two of our healthcare workers here from Maryknoll Fathers and Brothers. I'd like to welcome Sue Anello, who is the Director of Nursing Assisted Living, and Jackie Perrier, who is the Coordinator of Social Services and Activities. Welcome, ladies.
Thank you.
So I'd like to ask you a few questions that you can tell us about the health services here at Maryknoll. And first, I'd like you to explain what makes Maryknoll's health delivery system different from other facilities.
Well, I think primarily it's very member-oriented, patient-centered care, which I think we're very fortunate to be able to provide that to our men.
That's wonderful.
I just want to piggyback on that myself. Yes, I've worked at various facilities, skilled nursing home, acute care, and I find that the medical care that's provided here is bar none. It's very person-centered. The men are involved in their healthcare, medical care that they get. And also, speaking with the doctors and with nurses, they're very involved in that. So that makes it really geared towards them.
That's wonderful. Tell me about how your teams work cohesively together. How do you work together in the care of the society members?
Well, there's a constant back and forth between nursing and social work. I mean, they're very intertwined. We also have a interdisciplinary team meeting that Jackie and I both attend every week with other members of the healthcare team and leadership to discuss specific members, their needs, whatever we need to do for them.
Okay.
And just to piggyback on what Sue says, for my department, it's a multidisciplinary approach in everything with nursing and also other disciplines here, housekeeping, various disciplines here. For me, when a member goes out, say they go to a hospital setting, we follow them in that setting, in the sense that Sue would reach out to hospital staff and would gain information how the member is doing in that setting. Prior to the pandemic, my staff and I, my social worker and I, would pay visits to these hospital settings to ensure what care the members receive in there. That information we'd bring back to Maryknoll. Either we would write it up in a document or we'd disseminate that information to Sue and she would convert that to her nursing staff. And so we find that as teamwork, we have to work cohesively to ensure that the overall need of the member is met.
And that also involves leadership is pretty much, society leadership is pretty much involved in the members and their care every step of the way. They are always part of the communication to, to the team. So
that's right. And
they're very supportive also of the healthcare.
That's right. And so there are occasions where there's a leadership member who is a healthcare agent of maybe an hospitalized member. And we have to involve that, person into the member's care. We have, when we send out emails saying how the member is doing, that leadership member is CC'd on and is kept abreast of all the medical care that the member is receiving and how things are going along until that member returns. And I just want to add on to this too, that prior to the pandemic, and if a member becomes ill enough where they need subacute care, restorative therapy, then that member is sent to a nursing facility, and my social worker and I would follow that member in, the skilled nursing care. We would attend care plan meetings. We would be involved in the goals that are set in that nursing home. And we'll bring that information back to nursing here to Sue. And we all would discuss, and so we're we're intertwined. We work collaboratively, and it's a multidisciplinary approach to all the members.
Absolutely.
I'm going to direct a question to you, Jackie, for just 1 second. Your title is Coordinator of Social Services and Activities. What kind of activities do you plan for the men? What is it things that they enjoy to do, or are there health-related activities that, is it both kinds?
So my staff, I can say I'm blessed with a dynamic staff here, activity staff at Maryknoll. And there are 3 people who are that I supervise in activities. And so the activity department, it runs a gamut. We have, prior to COVID, the pandemic, we would go to the Bronx Zoo. We would go to out for restaurants. We would go boat rides. We would go to Broadway shows. We run a gamut. Activities since the pandemic, we have been mostly doing activities indoor. We have aromatherapy. We have horticultural activities. We, individual in-room therapy sessions with them where we'd go in and just talk with the members, listen to them. You can never hear their stories enough. They're so rich. And so we would spend time with them, in their rooms, just talking with them, listening to them, and most importantly, listening to them.
I'm sure that these activities that you engage in with the society members has some kind of I'm going to assume, positive effect, Sue, on their overall health care and well-being. Yes?
Oh, absolutely.
Absolutely.
They need to, the guys, they need to be engaged. And I think the pandemic really posed a great challenge for them and the activity staff. Now, I wasn't here at that time, but just speaking to my nursing staff and to Jackie and, other members, that the isolation that the pandemic warranted, really impacted the guys. So activities played a huge role in kind of keeping them as interactive as they could at the time,
Yes.
without safety issues, in terms of communicating the disease.
Absolutely. And this segue into the 3rd question, actually, because that's one of the things. We know that socialization is good for everybody, especially for older adults. And, isolation, we know it has a depressing effect. So we try to ward that off as much as possible and ensure, regardless of pandemic, no pandemic, we engage the men in activities of their choice, and they're involved. We have them involved in stating, okay, what would you like to see for a movie? What would you like? Where would you like to go? Where would you like to eat? They're involved in the decision making. We don't just make the decisions for them. We have them involved, yes, in the decision making, and we go based on what they say. We may say, okay, we have 10 members, you may choose this. So we'll go with one this week, we go to another one. We also have, book clubs where the men choose books that they want to read, and it's read in a group session. And then there's discussion after the book is done. So we have a lot of activities that bring the men out into, for socialization, so as to prevent the isolation piece. Yes.
That's great. Is there a common reward that your staffs experience in caring for these society members?
I think most of the staff would agree with me that the biggest reward is the relationship that we have with each of these men. I mean, you hear their stories, especially their stories in mission. I mean, these guys are tough men, and they when they talk about their work in mission, it's really amazing the work that they have done. And when they start talking about it, it's delightful to listen to, and it's amazing what they have been through. So I think that's probably the biggest reward for everyone. And I think all of the staff here, because we don't really have a high turnover rate, especially as it relates to the nursing and the nursing aid staff.
Absolutely.
You know, they develop bonds with these guys, and you know, that's a huge reward to anyone in healthcare.
That is true. The men are very humble. And for me, I find that, you know, no matter what, it could be a major thing as to accompanying them on a medical appointment, to a simple thing as picking up a pin off the floor. Thank you. You know, they say thank you. And for that, you know, that's a reward. That's rewarding for us. They're so humble in what they do and say. So for me,
That's
Not that you don't get cranky once in a while, but that's okay. You know, we're all human. We're all human.
that is true.
So Sue, I'm going to start with you. Has there been a specific experience that you've had in providing care for our members that stands out, that maybe spiritually lifted you or guided you or inspired you?
Oh, I'm telling, just being part of caring for these men. You know, I was here for 8 years, 5 years ago, and developed relationships with many of the men. And honestly, I was so happy to be back here when I received a call about 3 months ago that they were interested in having me back. I was absolutely thrilled. And I mean, I have pictures of some of the men that have passed away in my office because they made such an impact on me. And you know, that you really cannot forget any of these guys. They are an unforgettable group of men.
How about
Absolutely.
you, Jackie? Do you have, is there any one specific experience that you may have had that inspired you or guided you?
Chuck, there's so many, but I will just I will just say my most recent. So just recently, about 3 weeks ago, 3 to 4 weeks ago, or maybe less, we have a member who passed away that I've grown very, very, very fond of. And I think he likewise of me. And so prior to his decline in health, you know, I would visit him almost every day in his room that the 5 days that I work here, just to say hi, just to see how he's doing, give him a hug, you know, and say, I love you. And on one occasion I said, I love you so much. And he said, you said that to all the guys here. And I said, well, only to the special ones, you know. But yeah, so during the process and watching him decline in health, and, you know, it brought tears to my eyes. I got emotional on more than one occasion. And so, you know, I would try to hide from him not seeing me teary. And, you know, he saw me more than once and he said, don't cry, it's okay. You know, I'm going to a better place. It's okay, don't cry. And so that to me, you know, speaks volume. You know, it relieves me of my stress and the pain that I was carrying for him, and set me and gave me that peace that I was looking for. He was already at peace, but I wasn't there yet. So he gave me that peace that I could really let go and say, you know what, God will be done.
A good statement of his faith. That's
Yes.
wonderful.
Oh, absolutely.
Yes, yes.
Absolutely.
I really want to thank the two of you for joining us today. I've enjoyed speaking with you very much. I'm looking forward to speaking with the society members because in July, Pope Francis' prayer intention is for the elderly. And
Oh, that's
while
great.
we have society members of all ages and new ones coming all the time, I am looking forward to speaking to some of our older members and hearing of their stories of mission and growth in faith as a result of their work in the regions where we serve in Africa, Asia, and Latin America, and here in the US.
Yeah.
That's right.
So thank you so much, ladies, and
Very
I
welcome.
appreciate your time.
Thank you,
for
Chuck.
having us.
Thank you.